This week, we're going to learn about pelvic inflammatory disease, PID, an important health condition that affects the female reproductive system. In this lesson, we will understand what PID is, its causes, risk factors, and how it develops in the body, pathophysiology. We will also discuss its clinical features, complications, and, most importantly, how it can be prevented. By the end of this session, you will have a clear understanding of PID and why early diagnosis and prevention are very important for protecting women's reproductive health. Before we continue, don't forget to like, subscribe, and share so you don't miss more informative and life-changing health lessons like this. Definition of PID. Pelvic inflammatory disease, PID, is an infection of a woman's uterus, fallopian tubes, or ovaries, usually caused by bacteria from the vagina or cervix. If not treated, it can cause pain, fertility problems, and other complications. Causes of PID. 1. Sexual transmitted infections, STIs, the most common cause. Chlamydia trachomatis, Neisseria gonorrhea. 2. Other bacteria, polymicrobial infections. Mycoplasma genitalium, Gardnerella vaginalis. Anaerobic bacteria from the vagina. 3. Medical procedures that introduce bacteria into the uterus. Intrauterine IUD insertion, abortion or miscarriage procedures, endometrial biopsy, cesarean section. 4. Vaginal factors that allow bacterial overgrowth. Vaginal douching disrupts normal flora. 5. Sexual risk factors that increase exposure. Multiple sexual partners. New sexual partner. Partner with untreated STI. Risk factor of PID. 1. Multiple sexual partners. Women who have many sexual partners are more likely to be exposed to bacteria that can cause PID. Each new partner may carry an infection without knowing it. 2. Young age, under 25 years. Younger women are more likely to get PID because their cervix, entrance to the uterus, is not fully mature. Bacteria can get in more easily. 3. Previous PID infection. If a woman had PID before, she is at higher risk again. Previous infection may leave scars that make it easier for bacteria to reach upper reproductive organs. 4. Unprotected sex. Not using condoms increases the risk of catching bacteria that cause PID. Barrier protection, condoms, stop bacteria from entering. 5. Recent IUD insertion. Getting an IUD can slightly increase risk right after insertion. Inserting a device can carry bacteria into the uterus if sterilization is not perfect. 6. Vaginal douching. Cleaning the vagina with chemicals or sprays can disrupt healthy bacteria. Good bacteria normally protect you. Disturbing them allows harmful bacteria to grow. 7. Partner with untreated STI. Having a partner with an infection like chlamydia or gonorrhea increases risk. Infection can easily pass from partner to woman. 8. New sexual partner. Starting a relationship with a new partner can increase risk. New partners might carry infections without knowing it. 9. Lack of access to health care. People who can't easily go for checkups or STI treatment are at more risk. Infections can go unnoticed and untreated, allowing PID to develop. 10. Recent gynecological procedures, abortion, surgery, biopsy. Procedures that involve the uterus or cervix can increase risk temporarily. Any opening or disruption can allow bacteria to enter upper reproductive organs. Pathophysiology of PID. Pelvic inflammatory disease, PID, represents an ascending polymicrobial infection of the female upper genital tract, most commonly initiated by sexually transmitted pathogens such as Chlamydia trachomatis and Neisseria gonorrhea. Microorganisms typically colonize the endocervix and breach the cervical mucosal barrier, facilitating upward migration into the endometrial cavity, fallopian tubes, salpingitis, and in advanced cases, the ovaries, oophoritis, and pelvic peritoneum. The host immune response, characterized by neutrophilic and macrophage infiltration with release of pro-inflammatory cytokines such as IL-1, IL-6, and TNF-alpha, results in mucosal edema, hyperemia, and epithelial disruption. In the fallopian tubes, acute inflammation. Clinical features of PID. Lower abdominal or pelvic pain, most common presenting symptom. Cervical motion tenderness, pain when the cervix is gently moved. Uterine tenderness, pain when the uterus is palpated. Adnexal, fallopian tube or ovary, tenderness, pain when the adnexa are examined. Abnormal vaginal discharge, especially purulent or foul-smelling. Supporting features. Fever, usually greater than 38.3 degrees Celsius or 100.4 degrees Fahrenheit. Elevated inflammatory markers, e.g. WBC count, ESR, or CRP, lab tests. Positive STI test, Chlamydia trachomatis or Neisseria gonorrhea. Intermenstrual bleeding or menorrhagia, irregular or heavy periods. Dyspareunia, pain during sexual intercourse. Complications of PID. 1. Infertility, difficulty getting pregnant. PID can cause scarring and blockage in the fallopian tubes. Eggs cannot travel from the ovary to the uterus, so pregnancy may not happen. 2. Ectopic pregnancy. If tubes are damaged, an egg may implant outside the uterus, usually in a fallopian tube. Tube damage from PID makes normal pregnancy inside the uterus impossible, which is dangerous for the woman. 3. Chronic pelvic pain. Long-term inflammation and scarring can cause ongoing pain in the lower abdomen. Scar tissue pulls and irritates organs, causing constant discomfort. 4. Tubo-ovarian abscess. A pocket of pus can form in the ovary or fallopian tube. Body tries to trap the infection, but it forms a painful lump that may need treatment or surgery. 5. Hydrosalpinx, fluid in blocked tubes. Blocked tubes can fill with fluid. This prevents eggs from moving through, leading to infertility or pregnancy problems. 6. Painful sexual intercourse, dyspareunia. Scar tissue and chronic inflammation can make sex painful. The tissues are tight, inflamed, or irritated. 7. Peritonitis, infection in the abdomen. If an abscess bursts, infection spreads to the abdominal cavity. This is a serious emergency, causing severe pain, fever, and potentially life-threatening. 8. Sepsis, rare, body-wide infection. If infection spreads to the blood. Body reacts strongly to bacteria, causing fever, low blood pressure, and potentially organ failure. 9. Recurrence of PID. Women who had PID can get it again. Simple reason. Damaged tissues and untreated partners make reinfection easier. 11. Adhesions, internal scar tissue. Scar tissue can stick organs together inside the pelvis. Simple reason. This can cause bowel obstruction, chronic pain, and fertility problems. 11. Fitzhugh-Curtis syndrome, liver capsule inflammation. Rare complication where bacteria reach the liver capsule, causing upper right abdominal pain.
The liver tissue itself usually stays healthy, but scar-like adhesions may form between the liver and the diaphragm. Prevention of PID. 1. Primary prevention, preventing the disease before it occurs. Safe sexual practices. Use condoms. Limit number of sexual partners. STI education. Teach young women and men about risks of sexually transmitted infections. Vaccination. HPV vaccination may reduce cervical changes that predispose to infection. Avoid vaginal douching. Maintains healthy vaginal flora to prevent bacterial overgrowth. Sterile gynecological procedures. Ensure proper aseptic techniques during IUD insertion, abortion, or surgery. Goal: stop infection from happening in the first place. 2. Secondary prevention. Early